sex has a lot to do with a lot of things. And so I think figuring that out for women and bringing it to the forefront, I feel like it's really important.
For most women, and given our lifespan today, a lot of us will spend, or a lot of women will spend, half of their life almost in menopause. Wow. Because menopause can start for some people as early as 35. And the average age in the United States is 51 years old. It's the fact that your skin feels drier, your hair feels drier, you're losing hair, that you're at higher risk for cardiovascular disease, you're at higher risk for bone density issues. Something, unfortunately, that a lot of people in Western medicine who don't specialize in hormone therapy forget to give to women.
Yeah.
And it's a shame.
Hey, everybody, it's Erin Alonso. I just am excited today to have Dr. David on. We are going to talk about something that I don't feel like is talked about enough. And, well, maybe it is and maybe not in the right way. It's women's sexual health, women's menopause, and being in menopause myself. Wow, I have so many questions. I'm confused. What's happening? I thought PMS was bad. Woo! PMS has got nothing on menopause, boy. Woo-hoo-hoo-hoo. And I don't think women of yesterday ever, I don't know. I talked to my mom about it. She goes, oh, yeah, I think that I go, you think that happened to you? It's like for 10 years. You think that happened to you? Like, I don't know why those other generations weren't screaming about it or saying anything about it. It's like not even really mentioned.
Yeah. Thank you, Erin, for having me on your show. Totally agree with you. I think, especially in the United States, we've had this sort of taboo in regards to sex and feeling sexual or desirable.
Yeah.
And I think it's changing dramatically. So all of a sudden, you've got this floodgate of information. All these people are wanting to talk about it, learning about it. And so love that we're going to talk about this.
Yeah, I love it too. I'm glad that somebody's realized it's that important. So you used to be an OBGYN. Let's tell everybody a little bit about your background and how you started and how'd you end up here.
So I'm a second generation OBGYN. So I've kind of grown up in women's health my whole life. Made the decision to pursue in that field. In 2005, I graduated, started at Cedars-Sinai. And almost immediately, the chairman of Cedars-Sinai came up to me because I was young, I had a small practice. I was covering the free clinic with the residents and doing a lot of teaching. And he said, look, there's this thing called vaginal rejuvenation by a Dr. David Madlock. And we're very anti this whole movement. And I want you to write a paper that's going to be antagonist to it. And you'll get published. And I said, well, that sounds good. I'd love to get published.
Yeah.
Did my research, interviewed Dr. David Madlock, and said, my God, this is the future.
You're like,
so I literally took everything I had left in the bank in 2005 and started a fellowship in this. My dad then came up and, there wasn't much internet back in the day.
Yeah.
My dad, who's a traditional OBGYN, said, listen, Dave, slow down. You need to really hone your craft, do a lot of deliveries, do a lot of surgeries. And then when you're in your 50s, you can play around with this stuff.
Yeah.
So I did. I practiced as a general OBGYN. I did a lot of robotic surgery in the day. I did the first single incision hysterectomy in Los Angeles as an outpatient. So we removed the whole uterus out of the belly button incision. So pretty cool stuff.
Yeah.
But I saw, although I loved it, I was working so hard. And it was
a rough job.
It was a rough job. And I always had this passion for beauty, for surgery, and putting it all together kind of led me down this cosmetic gynecology track. Okay. And in 2017, I decided to just pursue that entirely.
All right. Good for you. That's kind of like my role too. When I was doing dermatology, I remember when Botox first came out and I had this article in my pocket because there was no internet. And I kept telling my boss, who was an old school dermatologist, and he was like, that's a waste. You're a waste of an education and all this kind of stuff too. So same kind of deal. Yeah. And I was like, but
it worked.
But I love it. Wait. Yeah. So kind of the same road. It's like people aren't going to like it because it's not the road that's the most traveled, right? So you got to kind of go, well, I'm not going to take the road that's most traveled, and that's what it is.
Well, to give you a great example, in 2012, the chairman at St. John's Hospital in Santa Monica came up to me, who's a good friend of my dad's. He said, Dave, look, everybody loves you at the hospital. You're a good surgeon, but you got to take this stuff off your website.
Oh, no.
And if you do, then you'll join this really big practice that's very prestigious in the community, but they don't want to take you on as long as you have this stuff. Thought about it hard.
That.
And then I decided, no, I'm going to follow what I want to do. And a few years later, he came up and called me and said, "Do you mind teaching me this?"
Oh, that's like my boss too. A couple of years later came and asked me if I would inject Botox there. I couldn't believe it.
Exactly.
I was like,
so
what?
I think that's just part of life, right? It just kind of goes full
no one
circle.
likes change. Change is uncomfortable.
Yeah.
Right? So especially in medicine, like you don't want to go and have to relearn stuff or figure it out again, or like, wait a minute, we're trained the way we're trained and this is what we're doing. Let's just stick with it. Yeah. And so,
we got
here
some
my
friends.
Yeah, the friends join sometimes. Hi guys. So anyway, yeah, I think that it's important to change though, as things change. And, I think talking about all of it too is important. Like, what is going on, and our bodies, I think, are now, we're just going to talk about things more, and it needs to happen. I think it needs to be out there and open, and it is a part of our body and our health. And, sex has a lot to do with a lot of things. And so I think figuring that out for women and bringing it to the forefront, I feel like it's really important. I talk about it with my patients nonstop, and none of them know what to do, and none of them know what's going on. And they think I'm their guru. And I'm like, I don't even know what's going on. Like, don't look at me. Just because I do your Botox well doesn't mean I know about everything else. I mean, we dabble in it and do things that we know will, like the M-Cellitaire will help tighten that muscle if you have incontinence, and then do CO2 laser. It'll help with incontinence too, but it doesn't help with a lot of the other things that are going on with the body, the weight gain and the irritability and all the, there's a lot that goes into menopause that I don't think people think about enough. So
yeah, well, if you're okay with it, Erin, I'd love to jump in and talk a little bit about menopause.
Tell us all.
So look, I think the misconception is that it is a normal part of aging, but the misconception is that we have to deal with it and learn to live with it. I think the reality is that there's a lot of scary myths that have happened. There was a 2000 study called the Women's Health Initiative that showed that maybe there was a correlation between breast cancer and hormones.
Yep.
And I think that really threw a lot of people off. And most women in the United States at that time were completely taken off of hormones.
Yeah.
And then there was a pendulum that went the other way. And now I think it's in full swing towards the other side. And that's because, look, for most women, and given our lifespan today, a lot of us will spend, or a lot of women will spend, half of their life almost in menopause. Because menopause can start for some people as early as 35. And the average age in the United States is 51 years old.
Oh my gosh.
What people don't realize is that it's not just night sweats, hot flashes. It's just like you said, it's mental fogginess, inability to stay focused on certain things.
Right.
It's the fact that your skin feels drier, your hair feels drier, you're losing hair, that you're at higher risk for cardiovascular disease, you're at higher risk for bone density issues, you're at higher risk for gut health or poor gut health. You're at higher risk for macular degeneration of the eyes.
Yeah.
Your libido, your desire for sexuality goes down. Your lean body mass changes. Everybody starts to get a little bit of extra fat around their belly.
Fat, frumpy, and mean.
Yeah.
That's what it comes down to.
And then you have a hard time sleeping.
Yeah.
So, one of the most important pillars of health is good sleep.
Absolutely.
And if you're feeling, anxious, which is a hormone issue for a lot of people, then that's a big problem. And I'll give you an example. If you look at the statistics, when is the most common age that anti-anxiolytics or anxiolytic medications are prescribed?
In their 50s, I would bet.
And it's in their late 40s in women when their progesterone levels start to drop. But yet we treat everybody with SSRIs, with medications, and we're just putting a Band-Aid, and we're actually harming them.
Right.
Because once you get on an SSRI, it's really hard to get off of an SSRI. And it completely destroys your libido.
Right.
So I think in today's world, and this applies to men as well, I call it andropause.
Yeah.
So in my practice, we treat men and women, and we not only look at them as a whole, because I need to understand what your symptoms are, what you'd like to achieve, how you would like to feel better.
Right.
And then you do a comprehensive blood panel. And then I customize your hormones as an individual, not just a pharmaceutical brand where you have 3 doses.
Right.
Here, Erin, try dose number 1. We'll give it 3
right.
months. And then if it doesn't work, we'll switch to 2. And the second thing is your ovaries, your entire life have produced progesterone, estrogen, and testosterone.
Right.
And women need all three. Testosterone is super important for libido, for desire, for lean body mass, for mood elevation. And it's something, unfortunately, that a lot of people in Western medicine who don't specialize in hormone therapy forget to give to women.
Yeah.
And it's a shame.
Yep. I feel you. I feel like that is a big issue. I know that even like I've had a history of breast cancer, and when I went to go talk to my OBGYN about it, she wanted me to go get cleared by my oncologist. And I thought, oh no, my oncologist is this 80-year-old man. I was just weepy going, what's he going to say? Or he's not going to. Anyway, I loved it. He was so great. He's like, that study is so old. Is she not
love
up
that
on
you
it?
said that.
I was
Yes.
like, thank you.
So
it was
just to clarify that, because I think it's really an important topic. I hear this all the time.
Yep.
I can't start hormones because my great aunt had breast cancer or my mom had breast cancer.
Right. I tell women every day, I had actual cancer and I'm on hormones.
Yep. Exactly.
Period. Like by an actual oncologist, not even an OBGYN.
Yeah.
But, he was the one that was like, you get on those immediately. You're a small woman with your bones are going to break and you're going to have a heart attack. Get on that. And I was like, oh, what? And so I was just so happy to hear that from him. It's Dr. Link right across the street
okay.
from you, the real Dr. Link.
Yeah, the real Dr. Link.
Yeah.
I love that. So I think you brought up a couple of good points. From a cardiovascular standpoint, if you look at women during their reproductive years, their risk of a heart attack is minimal.
Right.
The moment they go through menopause, if they go untreated without hormones, within a year, their risk of a heart attack is the same as any man.
Wow.
So just in cardiovascular health, being on hormone therapy is super important. Second, I think when it comes to breast cancer, there's 3 types of estrogen. Right. And the old Premarin is what we used to use when that study was done.
Right.
And that's an equine made from a horse's urine, and it's taken orally. And when that estrogen is metabolized by your liver, it gets converted into estrone. Estrone is the bad estrogen that stimulates your breasts. But when you're doing patches, creams, pellets, which is what I specialize in, made especially from bioidentical hormones, which are hormones that are plant-based.
Right.
They have an almost identical molecular structure to your own body's production, so your body doesn't know the difference.
Right.
The progesterone component of it is what's really important. So synthetic progesterone has been shown to potentially increase the incidence of breast cancer. But when you're doing it on a natural plant-based type of medication, then I think the risk is minimal.
Right. It's great.
I think it's protective, actually.
Yeah. So yeah, you've got to kind of weigh out your own health and do it with somebody that understands your health history and like what you're going through, and then you make a decision like that. But yeah, the overall just blanket statement of, it causes breast cancer, I'm not going to do it, is crazy. And that, I don't know how to even get that out there enough, but it's still like just resonating in everybody's head, right? Of like, get that out of your head. I don't know. I even was going to tell him, like, even if it does cause breast cancer, I feel that bad. I don't even care. I don't care. I'll get breast cancer again. Like, I can't live the rest of my life like homicidal and suicidal. Like, I just cannot. I need do something for me to help me. And so started my journey of like trying to, fix that and, make it better. So I'm so glad that there's somebody like you around that is doing it and just doing that too, and not delivering babies. Because who wants to go to a doctor who calls you when you're on the way there and like, oh, he went to a delivery. Sorry about that. You get call back for another appointment.
Right.
And
that was sort of the impetus on why I had to leave. I love delivering babies because there's an incredible bond you have with parents.
Yeah, of course.
I think I was pretty good at it, and I had a pretty big following. But you couldn't do cosmetic gynecology, have somebody come in for a vaginal tightening surgery or a labia reduction who's going to pay you a significant amount of money and really wants your one-on-one attention, and then have a laboring patient who's 8 centimeters in the hospital.
That's right. And you
you're
got to
trying
go.
to rush, right? So it just didn't go. So I had to make a decision, and I've completely pivoted into sexual medicine and helping women feel more empowered about how they feel and look.
I love that. Well, that sounds great. I think that it's way over. It's just time for all of it. So are you just, so you're in Orange, I guess, right? Is that?
So I have an office still in Los Angeles and then one in the city of Orange. Yeah.
Okay. That's awesome. What do you think about all these things that are coming to light? Like, I guess there's like some funky trends that go on, like those yoni stones, or like, have you heard of, I've even heard of like vaginal sunbathing. And do you know about these things?
So I don't know that I'm an expert in anytime the word sunbathing to me is just absorbing sun. And I'm a huge fan of absorbing sun because I
Yeah.
think, first of all, just to bring up another point, when I do my panels in my office, I would say probably 50% plus of all women and men are vitamin D3 deficient.
I feel it. Yep, I know.
And there's so many good things from making sure you're vitamin D3 from cardio protection. It's a hormone regulator. It's an immune booster. And the fact that
I read recently that we should have 2 hours a day of natural sunlight. And I don't think anybody gets that anymore. That's a lot.
That's a lot. I mean, I have a
2
routine. I
hours
like
a
to
day.
walk in the morning.
Okay.
And I think for me, that's great because you're a little protected from some of the UV rays. And I think, there's routines that I think biohacking routines that work amazing.
Yeah.
But I think sun is one of the best you can do.
Yeah, just, I guess, don't burn your vagina if you're going to do any vaginal sunbathing, right? It's going to be I would think it's a little whiter down there. So, yeah, then there's vaginal steaming with all this herbs down there.
I'm not sure.
Okay. All right. Well, I had to ask just because people are coming up with some wild stuff ever since I think Gwyneth Paltrow made that candle of her vagina,
Gwyneth
right?
Paltrow, yeah.
Yeah. Everyone started doing all kinds of
that's true.
Whatever. What's the other one, Megan?
So, I think the eggs and all of these devices, there's some very cool devices, actually. We've come a long way. There is, outside of the egg, it's all about rehabilitating your pelvic floor, right? Having babies is really difficult because you've got this big head coming out of your vagina and it stretches your pelvic floor muscles. And if you have more than one child, especially a vaginal delivery, but it's a myth, even C-section babies can cause havoc because a lot of C-sections today, moms have gone through labor, failed labor, and then end up with a C-section, and then they have a double whammy. However, anytime you can fix the pelvic floor, so, Kegel exercises, the balls, there's even some really cool games where you put sort of like a little vibrator toy inside your vagina. There's a Bluetooth Wi-Fi connection to your cell phone. And you play a game on your cell phone. And it's basically butterflies that land on flowers and you have to make the butterfly fly. But you're doing that by contracting your pelvic floor muscles. And I like it because
think of everything, boy. They all right.
But anytime you bring competition into it and high scores, people want to do it more.
Yeah. Oh, my gosh. So you can compete.
And you can compete against your friends.
All right, ladies, it's on, right? We're going to have to get that vaginal floor kicking. Let's see. That's very interesting. Okay. I wonder if you could cheat with the Emcella and the egg at the same time and just, on that chair, just kind of see how strong it contracts down there.
You just don't want to scramble anything.
Yeah, no scrambled eggs for sure. Yeah. I guess it's metal. You wouldn't be able to do it, right? Anything that's got Wi-Fi, I think it's probably a no. And then what the other one was, we wanted to talk about gut health too, like how. Do you do that in your practice, gut health for vaginal health?
So, I'm starting because as I'm getting older, I'm getting more fascinated with all this stuff. So I definitely have been taking a lot more courses on better understanding gut health because at the end of the day, gut health is probably the most important thing you can do. I mean,
right.
I think the number one issue with chronic disease, cancers, is inflammation and insulin resistance.
Right.
And I think it all stems from poor gut health, leaky gut. And so there's a lot of, and I think this brings back another point. When I'm doing a hormone consult, it's not just about hormones. I need to understand what supplements you're taking. And the reality is if you're going to go have 3 glasses of wine every night and eat poorly, I can put you on all the hormones you want and you're not going to feel your best.
That's right.
Right. So we have to optimize you as a whole and then really accentuate gut health, hormone optimization, perhaps peptides, to really get you to the next level.
Right. All right. And then, so how do women find you or what do we do to
so I have a website. I have an Instagram account, which maybe you can post.
Yeah.
My office phone number. We just started in the city of Orange last year, so we're definitely welcoming new patients, and I'm excited to be part of Orange County.
All right.
Yeah.
Oh, that's awesome. All right. Well, if you guys have any questions, you can always ask at DermFx too, and we will direct them right to you because we got lots of people with lots of questions. So as this unrolls, I hope we have you again and we can just keep adding to it.
Awesome.
The other thing that I really want to talk about is labia puffing. I've gotten quite a few now. People, it tends to be a lot of, I feel like, girls that are on the OnlyFans, because I'm looking at, even with their camera, we're taking pictures from different angles to see if like I got that labia puffed out right. Are you seeing that?
Yeah, we're seeing a lot of labia puffing. So I think the trend came from BBLs.
Yes,
So
I do too.
you've
Because
got the BBLs, and then all of a sudden, if
your
it's in the back,
vagina looks
why
tiny.
not? Why not? So the reality is this, unfortunately, as we age, nothing good happens.
Right.
So in the labia majoras, underneath, you have fat pads. And what typically happens is over time, if you've lost weight, gained weight, if you've had children, as we age, we lose these fat pads just like we do in the face.
Right.
And once we lose fat pads in the labia majoras, they become saggier, a little more wrinkly in appearance.
Right.
So it can be a comfort issue. It can be a self-confidence issue. So we've been getting a lot of volume enhancing requests for the labia majoras. And I've done it 2 ways, and I'll tell you what I prefer best. There was a time where I was doing quite a bit of, like we would liposuction the mons area, which is right above the vulva, because a lot of, especially after deliveries, you get a little bit of extra adipose, that little mound right there. And it can be, an issue if you're wearing a lot of tight clothes.
It can.
And then we would transfer fat into the labia majoras.
Oh.
The reality is, even though I think it's great because it lasts longer, it's got a very soft, natural feel to it.
Uh-huh.
The reality is it's not like a BBL. It's a very, that compartment, you can't put that much fat into it.
Right.
And so you're always going to have a certain percentage of cells that are not going to remain viable.
Right, because they've got to adhere.
You lose fat, right?
Right.
So then all of a sudden, and to me, look, because I love what I do, I'm a perfectionist, and we charge patients, it's not an insurance covered procedure.
Okay.
The last thing you want to do is have patients who are not entirely satisfied with their results.
Right.
And so I started seeing a small trend of patients who would lose fat in certain areas. And then we had 2 choices, either re-liposuction, which is a procedure. Who wants to go through that again?
Right.
Or add fillers. And so really, as of 2025, I made a decision that we would stop liposuctioning with fat transfer, even though I think it's a great procedure, and focus on fillers that I mix with PRP.
Okay.
And we inject that into the labia majoras. And I think it gives it a really nice youthful appearance. And patients are going crazy for it.
Yeah, they love it.
They love it.
They do. It's yeah. And are you finding it to be like women of all walks
ages
of life and every type of everything?
I do.
Yeah, me too. It's odd that it's like all over the place, which, and interesting that we had a big discussion with one of my patients that was telling me that it made her into a sexual rock star. And I said, well, it's psychological for a woman. So if you feel good, then you are a sexual rock star. And she's like, no, it's physical. It's physical. So we had this whole debate. And I was like, no, it's not physical. And she's like, yes, it is. She goes, because she probably comes and does it maybe twice a year with me. And we have this discussion every time, and I won't give in, and neither will she. And she's like, nope, I tested it all out. It is. So I was like, all right, well, we'll just have to leave it at that. But I don't know that you're going to have, what do you think? Do you have a better orgasm if you have
I don't think
labias?
adding, I think what you said is actually perfectly honest, which is if you feel better about yourself, you're more relaxed and you're enjoying the moment.
Yeah.
And you're orgasming better. I think that there are things you can do to really take you to the next level as far as pleasure and feeling orgasm. And that's, we do things where we add either PRP or exosomes to the G-spot,
right,
which is real, to the clitoral hood area where you have a complex of 8,000 clitoral nerves. So by adding those things, we're improving blood flow to the area. Anytime you can improve blood flow in sexual medicine,
right,
whether in men or women, good things happen.
Right.
And then there's growth factors involved. So taking it to the next level as far as orgasms, I love PRP or exosomes.
Okay.
Yeah.
Yeah. Well, good. I think every woman wants to know about that. We're all in desperate search for that. It gets, I think it's harder and harder as you get older, for men and women.
100%.
Just the rock star days, I don't know. They just sort of go, wah, wah, and it's like, if you could bring them back, who wouldn't?
And there's things we can do to do that. It's hormone optimization, healthy living, and then adding things like PRP or exosomes or lasers or M-cell chairs. These are all things that are going to bring you back in time to when you're your pelvic floor was stronger, you could squeeze better, you could have better orgasms.
Yeah.
And I think what a great way to live.
That's right. I mean,
Yeah.
if you got, why let that go? I mean, just if you can get all that back, it's important. It's a huge, important part of life. I think that you should never just be like, okay with letting go.
Well, they just did a study that came out. Women who experience 1 to 2 orgasms a week actually have longer longevity, improved moods, better cardiovascular health. So there's so many benefits in maintaining that intimacy.
Right.
Yeah.
Okay. Well, I think that ladies, we all know what we got to do then, right? It's just making an appointment, I guess, and get started and get on that train and figuring it all out, and just, hopefully that regular medicine's going to follow and make this just part of, it should be part of your wellness check. I feel like when you go see your doctor,
I think you should feel free. You should feel comfortable enough to discuss this with your OB/GYN, with your primary doctor, not just a specialist.
I believe that's me too. I do too.
Yeah.
And I think that's why so many women discuss it with me, because I know our specialists don't talk about it at all.
Exactly.
It's not even brought up. So that's a bummer. I'm glad that you exist with your menopause clinic and sexual health and all the rest. It's important. So
I agree.
All right. Well,
thank
thanks.
you, Erin.
Yeah, nice to have you on. And all right, everybody, Dr. David is in LA and in Orange. So we'll have his information down at the bottom for you.
Awesome.
All right.
Thank you.
Thanks, everybody.